Your kid is sick with a cold and they are coughing, and you are not sure what to expect or when to be concerned about the cough. My name's Alec. I'm a board certified pediatrician, and I treat the common cold in kids literally all day, every day, all the time. This is my third video now about the common cold. This one's gonna focus on the cough. But if you've seen the other ones, you know that if you're less than 6 years old, I expect the duration of your cold on average to last 2 weeks. Same with the cough. For the cough, I generally expect that it's gonna worsen for the first couple of days of the cold. It'll probably plateau for a little bit, and then gradually, slowly, we're gonna get better and better, and the cough might linger, but should be getting better over the course of those 2 weeks. Now, some kids will go on to get a post-viral cough, which is after those 2 weeks. Sometimes that can be 3 weeks, maybe up to 4 weeks, but really a cough that lasts longer than 4 weeks is now a chronic cough. Other etiologies should be considered. Now, what can you do for the cough? So if you're over 1 year old and you have a cough from an uncomplicated cold, honey. Honey is my favorite cough treatment for kids that are over 1. There are studies that support that it's effective in reducing cough frequency and severity, and it's very low risk for adverse side effects. Now, you cannot use it if you're under 1 year old because of your risk for botulism. Right, now when to be concerned and when to seek medical attention. These are some patterns I see that might suggest something else is going on besides just a common cold causing a cough. I can't list all of them, so if you're ever in doubt, please reach out to your healthcare provider. First is duration. So as I kind of mentioned, on average it's 2 weeks. Sometimes you get a post-viral cough up to 3 or 4 weeks. In that time, it should be gradually getting better, right? Anytime it lasts more than 3 to 4 weeks, you should probably be reaching out to get it evaluated. Second, so if your cough is following that pattern that I expect in that 2-3-ish week period where you are getting better and then all of a sudden it worsens, and especially if it's accompanied by a new fever, that could be concerning for pneumonia and it should be evaluated. Any noisy breathing, hard breathing, fast breathing, using all these muscles to breathe, especially outside of coughing episodes, I don't expect that from a cough from an uncomplicated viral illness in an otherwise healthy kid. That needs to be evaluated emergently to make sure that nothing else is going on or that we need to support them. It could be a foreign body in their airway, it could be croup, it could be pneumonia, it could be an asthma exacerbation, it could be like so many different things, but work of breathing should never go unevaluated. Now, it's also hard to differentiate like a cough from a cold from croup. So croup is some inflammation in your throat, and it tends to happen in toddler age kids, usually less than 5. Now the